During the coronavirus pandemic, it is more important than ever to ensure personal protective equipment, or PPE, is used correctly. We want to ensure the safety of healthcare teams across our system as we come together to tackle this urgent public health issue. Because intubation is an aerosol generating procedure, there are additional PPE requirements for those present in the room when intubation is performed on suspected or confirmed COVID-19 patients. PPE includes leg and foot covers, an isolation gown, an N95 respirator, a hood, a face shield, and gloves with extended cuffs. Intubation, donning and doffing must be done in a buddy system to verify successful compliance with the protocol. Please watch while we demonstrate the correct procedures for donning and doffing PPE for intubation. First, make sure you have the following items on hand in front of you and ready to go. Leg and foot covers, an isolation gown, an N95 respirator, a hood, a face shield, 2 pairs of gloves with extended cuffs. Please note that PPE supplies may vary from site to site and may not be exactly as those displayed in this video. Take the following steps when you are ready to put on the protective equipment. Remove all jewelry and watches. Perform hand hygiene using an alcohol-based hand rub and rub hands until dry, ensuring all surfaces of the hands are covered. Tie hair back securely if required. Don leg and foot covers. Perform hand hygiene using an alcohol-based hand rub and rub hands until dry, ensuring all surfaces of the hands are covered. Don an N95 respirator. Make sure you are wearing the respirator that you were fitted for. Place the respirator over your mouth and nose. Top strap first, then bottom strap. Ensure straps do not cross. Mold the top of the respirator to the bridge of your nose. Be sure to perform a user seal check. Donning with face shield. Don a surgical hood over the N95 respirator, completely covering the hair, the ears, and extends past the neck to the shoulders. Perform a seal check to ensure that the respirator seal is not affected. Don on a long-sleeved disposable gown that reaches to mid-calf. Secure neck and waist ties. Don a face shield over the N95 respirator and surgical hood to protect the eyes as well as the front and sides of the face. Don gloves. Don the first pair of gloves with extended cuffs. Pull the gown cuffs over the extended gloves. Put the thumbs through the thumb loops if applicable. Don the second pair of gloves and ensure gown cuffs are covered. Remove the PPE inside the patient's room at least 2 meters away from the patient. Remove the N95 respirator outside the patient's room after closing the door. Before doffing your PPE, ensure you are using the buddy system to read the steps aloud as you doff. Remove outer gloves. To remove the outer gloves, grab the outside edge near the wrist of one side and peel away, rolling the glove inside out. Reach under the second glove and peel away, creating a bag for the first glove. Discard the gloves immediately into the garbage. Sanitize your inner gloves with alcohol-based hand rub and rub gloves until dry, ensuring all surfaces are covered. Remove gown. To remove the gown, untie the waist ties and then pull to undo the neckties. Peel the gown forward using the outer side at the shoulder. Turn the gown inward and roll off the arm into a bundle. Discard the gown immediately into the garbage. Sanitize your inner gloves with alcohol-based hand rub and rub gloves until dry, ensuring all surfaces are covered. Removal with face shield. Take care not to touch the face when removing the face shield. Avoid touching the front surface of the face shield. Remove the face shield by tilting the head slightly forward, grasping the rear strap and pulling it gently over the head and allowing the face shield to fall forward, and then discard the shield. Sanitize your inner gloves with alcohol-based hand rub and rub gloves until dry, ensuring all surfaces are covered. Remove leg and foot covers. Pull off leg and foot covers, taking care not to contaminate pant legs. Sanitize your inner gloves with alcohol-based hand rub and rub gloves until dry, ensuring all surfaces are covered. Remove hood. To do this, tilt your head slightly, bend at the waist, grasp at the crown of the head and use one hand while closing your eyes to pull the hood forward, away from the body and off the head, being careful not to interfere with the N95 respirator. Dispose of hood. Sanitize your inner gloves with alcohol-based hand rub and rub gloves until dry, ensuring all surfaces are covered. Exit the patient's room and ensure the door is closed. Remove your inner gloves. To remove the inner gloves, grab the outside edge near the wrist of one side and peel away, rolling the glove inside out. Reach under the second glove and peel away, creating a bag for the first glove. Discard the gloves immediately into the garbage. Perform hand hygiene using an alcohol-based hand rub and rub hands until dry, ensuring all surfaces of the hands are covered. Remove your N95 respirator. It is important that you do not touch the front of the respirator. First, tilt your head forward, then grab the bottom strap, pull to the sides, then over your head. Next, grab the upper strap, pull to the side, then over your head and remove the respirator without touching the front of the respirator. Perform hand hygiene using an alcohol-based hand rub and rub hands until dry, ensuring all surfaces of the hands are covered.